Multilingualism is more than knowing how to speak multiple languages and understanding them. According to the world of neuroscience, multilingualism may also have cognitive boosting effects on children with autism. Past research has found that compared to toddlers with autism less than 3 years old reared in monolingual homes, bilingually exposed toddlers with autism are found to more frequently use gestures as well as vocalized. Another study found that children with autism ranging from 5 to 12 years old have sustained attention in regards to executive function when bilingual compared to those monolingual peers. More research has also been done to prove that children with autism who speak more than one languages genuinely perform better in skills because of the advantages of bilingualism. This particular study was conducted with children ranging from 6 to 11, and this study examined the performance in school and analyzed their narrative and social skills. The data shows that bilingual children were more articulate than monolingual children and did not struggle with stuttering or stammering over their words as much as other children. Bilingual children were also better at retelling a story that was previously read to them. This shows how more than one language can help a child improve their memory as well as their speech. The final finding of the specific study showed that it was easier for bilingual children to actually adapt to changes or to a new environment if necessary. The daily change from one language to another translates to their everyday lives and makes them more adaptive in social situations. Now, to understand more about this emerging topic, it's important to understand what autism is. So, autism spectrum disorder, also referred to as ASD in short, is a neurological and developmental disorder that can affect one's ability to communicate with others as well as affect their behavior and how they learn. Autism is a range and it can be diagnosed at any age, but usually appears in the first 2 years of life. Autism can include intellectual disabilities as well as differences in social and communication behaviors. Now, to understand autism spectrum disorder further, it's important to recognize the brain structures and how they differ in relation to ASD.
First, we must understand how bilingualism affects a person's brain neurologically. Speaking or learning more than one language changes specific structures of the brain in different ways, depending on their particular function. In the inferior parietal lobe, gray matter density increases. Gray matter is where nerve cells are concentrated, and it is responsible for processing and interpreting information. The gray matter in this region of the brain becomes more dense because people who speak more than one language use it so frequently because the inferior parietal lobe is responsible for learning and understanding vocabulary as well as switching between languages. The caudate nucleus of the brain is responsible for selecting, switching, and controlling what language is being used. This region of the brain is located in the basal ganglia. Bilinguals have increased activity in this part of the brain, which helps them smoothly transition from one language to another. There is also increased activity in the anterior cingulate cortex, or ACC. The ACC is a part of the limbic system that can be found above the corpus callosum near the frontal lobes and is responsible for monitoring situations and deciding which language to use in certain situations. People who speak more than one language are constantly solving these language conflicts when determining which language to use. The final neurological change is increased activity in Broca's area. Broca's area is located in the frontal lobe of the brain's left hemisphere and helps with producing speech and articulation. A bilingual person's Broca's area is more active because more focus is required when switching between languages or trying to use the language that they are less familiar with. A study from 2022 asked parents of both monolingual and bilingual children with ASD to monitor their children and complete questionnaires that would tell researchers more about the behavior of children with ASD in a natural environment where they are comfortable. After gathering all of the data from parents, psychologists saw clear advantages for bilingual children with ASD. Parents of bilingual children reported that their children had an easier time making friends and adapting to new changes. Bilingual children were more flexible and comfortable in new school and social settings, classifying them as more independent than monolingual children. They also were more willing to listen to their parents and authority figures and they did not need instructions repeated as many times as monolingual children did. Parents stated that their bilingual children were able to keep their areas and items fairly organized and clean without having to be told to do so. Lastly, parents also reported that their bilingual children generally exhibited better behavior overall. Bilingual children did not act out or disobey their parents as often as monolingual children did.
Well, as stated previously, there is a lot of research that has been done on ASD recently, but there are still a lot of ways that we can understand ASD better, especially when compared to multilingualism. But to recap, here are ways that multilingualism can come in handy with people with autism. So first of all, there is many cognitive advantages in executive function. Within the executive function domain is everything that qualifies as cognitive abilities, and this cognitive advantage in the executive domain is called bilingual advantage. So it is very much a recognized thing. Language skills are also enhanced, such as narrative, social, and storytelling skills. And then bilingual children with ASD have also been shown to display greater ability with working memory, metacognitive skills, organizational material, and self-monitoring than monolingual children. However, we do also recognize that multilingualism can affect a wide range of people, much like how it is seen in children with ASD. Children who are not tested for ASD and speak another language have advantages in executive control. So this isn't restricted to children. These findings have also been shown in older adults, and results have shown that there is a stronger ability to ignore irrelevant information, resolve competition or conflict across alternative responses, and switch between tasks. And finally, it has also been shown that bilingualism does delay the symptoms of Alzheimer's disease. And this was important to highlight because of the many myths that surround multilingualism. Which leads us to this section. These are four myths that we have covered and disproven today. So, first myth is that multilinguals face confusion when learning or speaking more than one language. Second is that there are delays of speech development. Third, there are disadvantages to executive control. And the final myth is that there is no value for groups who are most vulnerable, such as children and Asian adults. So, all the benefits we covered in this presentation have been shown to positively impact children and older adults with and without ASD. And that is all. Thank you for listening. We hope that you can take away a newfound awareness and potential support tools for children with ASD. And here are references.